Good afternoon, everyone. Welcome to the Clinton Presidential Center, and we're so glad you're here today. My name is Ginny Ehrlich. I'm the Chief Executive Officer of the Clinton Health Matters Initiative at the Clinton Foundation, and I am pleased to welcome you to the Presidential Center. And I will first want to thank all of you for your flexibility. As many of you know, this event was originally scheduled for last week, and your willingness to join us today on short notice right before the holidays really underscores your commitment and dedication to the community, so we really appreciate your flexibility. I also want to thank the Little Rock Foundation staff for hosting this event for us today. Stephanie Street, Executive Director of the Clinton Foundation, and Dean Skip Rutherford are here with us today, so thank you, Stephanie and Dean Rutherford, for joining us, and I'd like us all to recognize them. I also have to say, as an Oregonian, that I'm humbled to be welcoming you on behalf of my Little Rock colleagues here today. In 2007, former Governor Huckabee did honor me with an Arkansas Traveler Certificate, and I take that honor very seriously and share all of the wonderful things about Arkansas and Little Rock throughout my travels across the United States very seriously, but this is my first official duty in Arkansas as an Arkansas traveler. I realize most of you have been to the center many times before, and I hope you enjoy it as much as I do. From the presidential history to the dynamic temporary exhibits, the center is a tremendous resource for this community, and I take every opportunity to come back to Little Rock and enjoy the exhibits myself. Before we get on to our panel discussion, I'd like to recognize a few audience members who are joining us here. Pulaski County Judge Buddy Valines, Representative Fred Love, Representative Warwick Sabin, former Governor Jim Guy Tucker, Dr. Joe Thompson, Arkansas Surgeon General, Mayor Gary Fletcher of Jacksonville. Thank you for your service, and thank you for your dedication to the Clinton Foundation and the Clinton Health Matters Initiative. During lunch, we played a new Clinton Foundation video. Morgan Freeman certainly does a better job of explaining the work of the foundation than I ever could, but I want to explain how the Clinton Health Matters Initiative, which we'll be talking about more today, fits into this overall vision. The foundation creates partnerships of purpose among business, governments, NGOs, and individuals to improve global health and wellness, increase opportunities for women and girls, create economic opportunity and growth, and help communities address the effects of climate change. The Clinton Health Matters Initiative fits squarely into the health and wellness category, and that's why we're here today. We work to improve health and well-being of all people across the United States by activating individuals, communities, and organizations to make meaningful contributions to the health of others. We like to say that our overall mission and goal is to equally distribute the opportunity to be healthy for all. And we do that through national strategic partnerships, looking at digital platform and innovation as a way to really make sure that everyone has the opportunity to learn from those around the country. And we work across the country in 4 communities, Central Arkansas being one of 4 regions, to help transform the health of the community overall, to reduce preventable health outcomes, to reduce healthcare costs, and most importantly, to close health inequity and disparity gaps that we see in this region as well as across the country. Over the past year, since we've launched, we've enlisted many people in this room as our supporters and helpers, and we so appreciate all of the work you've done to help us. And today, after 175 of you all, as well as others from around the region, helped us develop a blueprint for action. a roadmap for how together we will work to improve the health and well-being of Central Arkansans by leveraging all of the great resources that already exist and really identifying what bold, audacious actions we can take on over the next 5 to 7 years to really improve the health of the region. So we're thrilled to be working with you. This is just the beginning. And today, in addition to unveiling the Blueprint for Action, which you have on your seats, I'm pleased to share with you a panel of 4 community leaders who have really already taken some of this work to action. And so let's get started. As the 4 panelists enter, I have the privilege of introducing them. And we'll do so, and then Dr. Ron will introduce our very special guest and moderator. Please help me welcome Mr. Shawnee Hightower, the Associate Director of Sales for Arkansas Verizon Wireless. Mr. Hightower has worked in this region for a number of years, and he is a native of Little Rock and a graduate of Little Rock Central High School and the University of Arkansas. He currently, in addition to his duties at Verizon, serves as the president of the board for Positive Atmosphere Reaches Kids and has worked on several civic boards throughout Arkansas and has more than 20 years of experience in the telecommunications industry. I'm also pleased to welcome Jamie Mayo, who is a medical provider and wellness director at Nabholz Construction. Ms. Mayo is an in-house medical provider and wellness director where she has successfully led efforts over the past 7 years. And as you'll hear today, her work has been recognized nationally, and she was a part of HBO's documentary on obesity entitled Weight of the Nation, and she'll be sharing the work that Nabholz Construction has done. In addition, she's a 6-time Ironman triathlon and ultra-marathon finisher. And you'll see that she's quite tireless when she joins us. Montine McNulty is the Executive Director of the Arkansas Hospitality Association. As the head of the Arkansas Hospitality Association, Montine has spent several decades helping the travel, lodging, restaurant, and tourism industries prosper in the natural state. Since 1997, she has served as the Executive Director of the Arkansas Hospitality Association, which combines the efforts of Arkansas restaurants, hotels, and motels, and the travel industry and their state associations. She's also participated since 1987 on the Parks and Tourism Board, and she's a board member and past chair of International Society of Hotel Association Executives, and is a board member of the Council of State Restaurant Association Executives and the American Hotel and Lodging Association. And lastly, Dr. Dan Ron will be joining us. He is the Chancellor of the University of Arkansas for Medical Sciences. As Chancellor of the University of Arkansas for Medical Sciences, Dr. Ron leads Arkansas's only academic health sciences center, which encompasses patient care, education, and research at locations across the state. Dr. Ron became UAM's 4th Chancellor in November 2009. He is also a nationally recognized researcher, clinician, and experienced administrator. Before coming to UAMS, he served as the president of the Medical College of Georgia and the senior vice chancellor for health and medical programs for the University System of Georgia. After earning his bachelor's and medical degrees at Yale, Dr. Ron completed his residency at Yale New Haven Hospital and a postdoctoral fellowship in rheumatology at Yale. And now I am pleased to welcome our panelists to the stage, and Dr. Ron will introduce our very special guest and moderator. Thank you so much.
Good afternoon. I'm Dan Ron, Chancellor at UAMS. I know I've met most of you, and it's really my pleasure this afternoon to introduce a man who's dedicated his life to public service and improving the well-being of others. Arkansas is truly fortunate to have had his leadership first as Attorney General and then as Governor. And as Arkansas's leader, he focused on improving Arkansans' educational levels and their overall quality of life. He went on to become President of the United States and then to work tirelessly to focus the nation and the world's attention on making meaningful contributions to health and health care of others, an endeavor that he has continued through the Bill, Hillary, and Chelsea Clinton Foundation to this day. And all of us in this room really share these same health and healthcare goals. UAMS and those of you as other health leaders strive to improve health and healthcare at a lower cost, something that we are committing ourselves to intentionally and with focus. President Clinton established this foundation to improve global health, to strengthen economies, and to promote healthier childhoods. Through its Clinton Health Matters initiative, the foundation is working to combat the alarming rise in childhood obesity and preventable disease. Much work has been done and even more lies ahead as we meet the challenges led by the foundation. The Central Arkansas Blueprint for Action can improve the economy, can improve education, can improve the environment, community safety, and health status of the residents in this region. On a personal note or on an institutional note, UAMS is very appreciative of the long history of support that we've received from the Clinton family. That includes the creation of a breast fellowship program in memory of President Clinton's mother, Virginia Clinton Kelly. We and all of us here today are grateful to continue partnering to promote improved health for Arkansans and beyond. So please join me now in welcoming President Bill Clinton.
Thank you very much. Thank you. Thank you very much. Thank you and good afternoon. First, I want to thank Dr. Ron, not just for the introduction, but for all the great work that UMS does. One of the most enjoyable parts of being governor was working to support the capacity of UAMS, the Cancer Research Center, and many other areas, and I thank you very much for the work that you and the staff do to help people all over Arkansas, even those who are not your patients. I want to thank Jamie Montine and Shawnee for being able to be here today, and we're going to have a little fun, I hope, in a few minutes, talking about what we're here to discuss. Governor Tucker, Judge Belines, Representative Love, Representative Sabin, thank you all for being here. When Jenny was speaking, I was thinking about how we started in our foundation working on healthcare. We began with this, what is now called the Alliance for a Healthier Generation, with the American Heart Association, trying to tackle the problem of childhood obesity, which was at the time and probably still is the #1 public health problem in our country. And I was frankly reluctant to get into it because turning around a culture is like trying to turn around the Titanic before you hit the iceberg. And because it's sometimes hard to keep score. It's hard to know whether you're actually making progress. Just last week, we got a study out that said for the first time in decades, at least the rate of obesity in America had stopped increasing. And I think we played some small part in that, partly by reducing by 90% the total calories in drinks shipped to our schools, and partly by getting more than 30 million kids who get contract food into a better diet. And that served as the basis for the guidelines the Agriculture Department has now adopted, covering all school meals. Now we work in 20,000 schools, soon to be 25,000, trying to improve exercise and nutrition. The relevance to that is this. When we started this project, so Jenny said, okay, we did that. Now, well, let's try to improve the health of communities. You got all these baby boomers retiring, and if we just use healthcare dollars at the same percentage as our parents did, we'll probably bankrupt the country. So we took on another one of those cultural avoid hitting the iceberg challenges, of which Central Arkansas is a part, along with Jacksonville, Greater Houston, and the Coachella Valley in California, which is a particularly interesting case because it has Palm Springs and some of the poorest people in America living in one county, sharing in some healthcare operations and not others. This is a very big deal for a number of reasons. The overall health of a community, we know, is determined by more than just the quality of healthcare providers or even access to them. Little Rock is at the center of efforts to address and reduce chronic diseases. More than 50% of the adults in Arkansas suffer from some kind of chronic disease, the most severe of which economically and because it leads to so many other problems is diabetes. We have to try to make healthier choices, and we have to make those choices easier if they're going to work. That means that we have to do more to make sure people across Central Arkansas are well-educated, gainfully employed, living in safe communities where there's access to healthy food and to green space, as well as access to health care. It's critical to residents because while the city is affordable for families, it also has one of the lowest median household incomes in America. And the rate of uninsured is nearly 40% among working-age Arkansans in some of our rural counties. In Little Rock, we see that 23% of the kids are living below the poverty line. That's significantly higher than it was when I was in office. This is a problem which has gotten worse all across America. 55% of Pulaski County's children are eligible for free or reduced lunches. When I was governor, we put $15 million, which was a lot of money back then in the Stone Age, into funding for early childhood education, for programs for prenatal care, for providing health care for low-income children, a lot of which was done under Hillary's prodding because she had spent so much time over the years working on that. But we have a lot of challenges. I think we all recognize that. And despite those challenges, I think it's important to recognize some of the progress that has been made. In April of 2012, the Centers for Medicare and Medicaid Services Innovation announced that Arkansas was one of just 7 geographic markets in the country chosen to participate in a major initiative to help physicians improve care for patients with chronic diseases and complex illnesses. Our state is also known for being one of the first to address childhood obesity by passing ambitious, comprehensive legislation and trying to take better care to inform children and their parents of their condition at an early point in their school careers. Arkansas was recently acknowledged for its efforts to negotiate a public-private partnership to increase health access to additional 200,000 people in the state. This is a very big deal. And I was thrilled about it because in spite of the unfolding drama on the individual healthcare market, the last chapter of which is yet to be written, the Medicaid expansions are going great across America where they have occurred. About 5 million more people are going to have access to health care. In the states that didn't do it, they're leaving 5 million people out of access to health care in a way that I suspect, Doctor, will put your counterparts in other states in a very difficult position because they won't have disproportionate share payments from the government anymore for uninsured people, and they won't have insured people to pay those bills. Arkansas won't have to face that, and that's something that we can all be proud of. So what our Health Matters Initiative is here to do is to try to build on all this good work and to move the needle forward by working with all kinds of partners to develop and implement strategies that will improve overall health. I want to thank everyone who helped to develop the blueprint for action for Central Arkansas. We try to get all the stakeholders in all these other 4 places. And we've just been asked to go into South Texas, which will be an interesting challenge for us, to try to make sure that you use what's already in every community to improve the overall health. So we're now going to have a little bit of a discussion here so that all of our panelists can tell you what they plan to do. But I can tell you what I think is going to happen. What I think is going to happen is you will see measurable improvements in health outcomes, and I believe that it will show economic benefits to Central Arkansas as well. I think that, for example, one of the things that I'm excited about is the effort being made to put out more community health workers. It's amazing to me when you look at the work, say, our foundation does in Africa. I was in Zambia this summer, and we were asked to go in there, as we always are, first to provide AIDS medicine and malaria medicine at the lowest possible cost. And then they said, well, could you train some more nurses? And so, yeah, we did that. And then they said, well, we still have too many people dying of waterborne diseases, especially kids. And so we wound up with a program to train community health workers to go in and reorganize these little villages, to move the sanitation facilities away from the houses, to lift all the cooking utensils off the ground, to do things that seem so basic here. But when I was there last summer, the healthcare minister said, oh, this stuff has done way more good than all the medicine you gave us. And so I think that that's also true in America. And so I want to say to all these people how profoundly grateful I am for willing to take one more flying leap here. We are starting something, the end of which we cannot know, but I do believe, based on the experience and the effort to reduce childhood obesity, we will have some measurable results, and you'll be able to feel good about it. So let's begin. I would like to start by asking all of you just to state what you think. Why'd you do this, and what do you think the biggest challenges we face are? If you could wave a magic wand and start dealing with these problems more or less in order, what do you think the biggest challenges in Central Arkansas are? And maybe we'll start at the end.
First of all,
Jamie, thank you.
Thank you for the opportunity to be here today. I'm honored to be, of course, with you and these folks as well, so thank you. As far as challenges go, I think there are probably 3 things in Central Arkansas. The first would be awareness. You can't fix problems that you don't know exist. The second would be buy-in. So yeah, I've got a problem, but do I really want to do anything to change it? And then the third is probably culture. I don't know if y'all are from Arkansas, but I love fried deer steak, and I love mashed potatoes and gravy, and I like black-eyed peas and cornbread and a little pecan pie for dessert. I get it. I live here. I was raised here. So I think culture is one of the biggest challenges. And I work in construction, and I'm driving the Titanic, and it's tough, but it can be done. So those are probably the things I feel are challenging.
How many employees does Navholz have?
We have about 1,000. Mm-hmm. And then I care for spouses also. So we have probably 1,200 to 1,300 folks.
And if you were guessing, more or less what percentage of your employed spouses and children could be benefited if we do all this right?
All of them. Absolutely. All of them.
Montine?
I also want to thank you for letting me be a part of this. And as far as why I'm doing this, representing the restaurant industry, we've seen a sea change in attitude over the past 10 years, from almost denial that people wanted healthy choices to really embracing those healthy choices. The biggest challenge I see is what has been said already twice, but it's changing a lifetime of habits and a way of thinking, and it's not going to be easy, and it's going to take a lot of partners doing it. I think that I know I can benefit in helping through the research and the good work that the National Restaurant Association has been doing in this area, because they've been on top of this and working towards solutions for a long time. So I hope that I can bring in a network of support in that way.
Swanee, Verizon's done an amazing number of partnerships already that contribute to a good kickoff for us. What do you think the biggest problems are?
You know, growing up here in Central Arkansas, it's a double, really a double opportunity for me. First, being as part of the Verizon Communications Organization, being a local company, we are very proud to be here with you this afternoon. And then growing up here in Pulaski County, I recognized growing up a lot of things that we did not have. And so those three things, if I had an opportunity to address, would immediately be education. We need to educate our city, our youth, our adults on what's truly needed for a healthier lifestyle. I think access is tremendous. You need access to opportunities such as healthier foods, healthier opportunities for our youth. And then, of course, communication. That constant communication back out to the city, to this county, to the state on what we're trying to do. I think that's going to be huge. We need to make sure that everybody is aware so everybody can participate really to make this project work well.
It's interesting that you say that, because I have to say I have been surprised everywhere we've worked with the Children's Initiative. You forget how routinized all of our lives become, and how many things we do every day that we don't analyze. Most people don't have time or space to just stop and analyze, well, is this a good or a bad thing? And if it's not a good thing, what are our options? We take for granted sometimes the simple power of that. And when we started with this, with our childhood obesity initiative, I remember one of the most interesting things to me was this a television chef named Rachel Ray decided she'd start giving one program every 2 or 3 weeks, just to show people how they could, if they didn't have any money at all to speak of, how they could afford to buy food that was good and prepare it in a hurry if they were busy. And I had so many people come up to me just on the street, and thank me for it, because they had never thought about it before. They just took it for granted that they had to live in a certain way and do a certain set of things. And I think you're right about that. What do you think, Doctor? What are our biggest challenges?
I think that, Mr. President, you really, already pointed to it. It's the cultural issue. I mean, what we've learned is that everything's connected to everything else, and that there is this complex interrelationship between educational attainment, poverty, and poor health. And the social determinants, be they environmental, built environment, rural environment, education, poverty status, family structure, behavioral factors, play a bigger role in determining health outcomes than the actual health care that's provided, which makes the problem extremely complex and cuts across sectors. So it really takes all hands on deck and a strategy that organizations and the community as a whole is willing to pursue over an extended period of time in a persistent way to effect the change. The second thing, in my opinion, is a sense of urgency. I believe that meaningful cultural change is so hard that in the absence of a sense of real urgency, it's hard to get it done. And I'm not convinced that in the private sector in general, or the public sector, or the community at large, there's a sense of the need for change, of the burning platform that's out there. You've alluded to it with regard to diabetes, obesity. We know we have a big problem with tobacco product use. We know we have an enormous problem with substance abuse. But I'm not convinced that we've made the case yet sufficiently that the future of the state in terms of any opportunities for economic advancement are linked to educational advancement and better health.
Well, apropos of that, one of the reasons that I have supported this whole healthcare thing from the beginning and for 20 years, apart from wanting to give everybody a chance to be insured who's not, is that I thought it would be the beginning of our examining why we would spend, at its peak 3 years ago, 17.8% of our income on healthcare, and no other country was spending more than, at the time, 11.8, which was $1 trillion a year we were spending, and we weren't healthier. And everybody wanted to look for demons, but nobody wanted to look at themselves in the mirror. And all of us in general. I'll give you an example that you may find laughable. When I moved into the White House in 1993, it seems like the dark ages now. The average cell phone weighed 5 pounds. And there were only 50 sites on the internet. And the NSA wouldn't have this email controversy back then because all the email was inter-office memos. But the thing I noticed about the White House was, first, it had one of those old push-button telephone systems where the numbers lit up and you pushed from the 1970s so everybody could listen to everybody else's conversation if they were on the same bank. But worse, something I didn't notice, but it looked like people were kind of dragging around, they had the same air filtration system they'd had for 50 years. And the West Wing was pretty closed down. Only the few of the offices had windows. A lot of them were underground, and everybody wanted to be there because it was close to the Oval Office. They changed out the air filters, but they never reworked the air filtration system for 50 years. And you were talking about the built environment. One of the things it seems to me we got to do is get people to re-examine everything. You'd be amazed. I came in and had them redo the air system, and it looked like people were skipping down the hallways. I was afraid I had too much exuberance there for a while, which apparently the American people agreed with from time to time. But anyway, it's an example, though, of where we are. So those are our challenges. It's been my experience when you try to do something big like this, you may have to start with something small that you can actually do so that you can put a score up on the scoreboard and people can see something can be done. So let's just start in reverse order. What do you think the greatest opportunities are? If you wanted to get something done in the next 6 months that could be done, what would you recommend that it be?
Well, I think you do have to take a bite out of the elephant. And I think that the blueprint for action includes a number of these steps. So number one, there are a lot of entities that are involved in this issue, and I think the convening opportunity of the Clinton Foundation and this Health Matters initiative to get all of the parties to work together is a huge issue. We are interested in focusing on our neighbors, so we're focused on the Promise neighborhood in Little Rock, which is right across 630 from where our campus is. There are 8 different organizations that are part of a cooperative venture there, and we're focusing on addressing the number one issue that the population identified through a student community assessment by students at the Clinton School, and that was that they wanted assistance with substance abuse. We've established a wellness center, and we're putting programs together to do that and linking it to the prescription drug monitoring program in the state, which I know that you know the importance of.
What do you think? What's something we could do in the next 6 months that would really make a difference?
Well, at Verizon, we really took a look at some of the landscape of what we were doing today. And also, as you touched on, Dr. Ron, with our partners and initially just try to take some small steps. Dr. Harrington is here, but we initially worked with the Baptist health systems and attack connection. We really wanted to address the rural part of the state and Pulaski County and say, how can we help those impacted areas quickly with opportunity? And as being a technology company, we knew that the key piece was connecting those individuals back to sources that could help them. Mobile broadband is what we do, and we're in the business of providing connections to the communities. Some of the busiest days in rural America are when those small clinics receive that doctor in that clinic on that particular day, and everyone knows that. But one of the biggest problems is receiving and conducting business in a technology-savvy opportunity, and to be proficient and efficient in that process. So mobile broadband pretty much delivers the ability for high-speed data to be transmitted back and forth, whether it's from the clinic to the main hospital, from the clinic to another clinic, from that patient back to that clinic. That is huge. That can help a clinic increase their revenue for that day. It can definitely help that clinic see much more individuals than previously, because they know that doctor may not be back for a while. So they may not be able to get that treatment for diabetes. They may not be able to get that treatment for cardiac issues. So we recognize that immediately. We have a process in place. We're establishing mobile broadband to over 150 clinics throughout the state, initially directing that toward the Pulaski County area, and really working with Baptist Health and really being a true partner to attack that initially. Second, we're doing something with the education front. Keith Jackson is here. We're with Park, and we partnered. The work that Park is doing in the schools, if you are not aware, is just tremendous. Taking those students which have a 1.6 or lower GPA, putting them through the program where they are resulting in students going off to college, which were not going before. That's huge in this community, because what happens is those individuals come back and they work for your corporation. They come back and they work in your communities, and they really, truly build the community as it should be. So what we're doing with those organizations is we're trying to make those individuals which work in Park much more productive and efficient also, by taking electronic tablets and taking our tablets and working with the counselors. So when they go into schools and work with counselors and they work with the administration, they can get that information back quicker. They can do it much more efficient, which the end result should be students being helped and that education level being raised in the state of Arkansas.
What do you know what percentage of our people have access to broadband with fairly rapid download speeds?
So, one thing we've at Verizon is we are very proud of what's called our 4G LTE network. We right now have in the state of Arkansas currently 98% of the population covered with high-speed broadband. The key is making sure they're aware of that, making sure they're educated, and also making sure they know where they can actually go out and get the service for help and needs, such as in those communities, whether it's for medical services or education or just simple things they do day to day in their communities.
But if 98% coverage is better than most states have, isn't it?
Oh, yeah. In Arkansas, we've been, actually in the United States, we now have over 90% of the population covered by broadband services today.
Montine, what would you do in the next 6 months if you could do one thing that would put something up on the scoreboard?
I think for us, it will be, in technology will be really important, but giving tools to restaurateurs to better do their job. If 71% of the public are wanting to eat healthier, I think the restaurateurs in the food industry needs to recognize that. We're a pretty entrepreneurial industry, and I think that there's opportunity there. We also have a new Arkansas Arts and Culinary Institute associated with Pulaski Technical College. I think they can be very instrumental and a great partner. They're well represented here today. And to teach the future chefs and students, because there are so many students and young people, and we see this in our high school program, they think the only way to eat food is to fry it. And so you have to start with that to show them that there are different ways to prepare and to have tasty food. And that's being demonstrated now more than ever. But I think that giving those tools, we've got a program called Ask the Nutritionist. They've got to be able to pull up things like that. We're going to be launching an allergens program that's an online program that was developed by the National Restaurant Association. That's so important for restaurants too. They get asked now, what's in this and that kind of thing. And they've got to be very familiar with their recipes and answer the public's questions. They're their customers, and they'll do it.
I'm going to veer off the program. I'm coming back to you, Jamie, but when I had my heart surgery, and we were trying to figure out how I could return to normal life and have a longer lifespan, I got a blood test that measured my level of allergies to more than 200 different things. And I found out I was allergic, at least to some degree, to like a dozen things I had no idea about. And it affected my cardiovascular system, my ability to breathe well and everything. So I appreciate it, but I thought, something like this would benefit people who, unlike me, didn't have a health insurance policy that would cover it or didn't have enough money just to pay for it. I think allergies are a big problem for kids in schools. I think that air quality is a big part of it, but there are other things involved. Is there anything we can do to broaden access so that more people will know at least the 5 worst things they might be allergic to?
Yes.
What?
Well, I think that the key step here is expanding insurance access and sustaining that so that there's a payer source to enable people to have appropriate testing is a good thing to do. I can't answer. I'm not going to pretend that I know the value of broad testing for potential allergies by blood testing. I can't answer that as to
I can't either. That's why I ask you.
What it translates into in terms of actual benefit. We certainly know that asthma is, other than dental caries, asthma is way up there as a leading cause for absenteeism in elementary school kids, and that's worse in areas where neighborhood air quality is poor and or there are fungal issues in the environment. Knowing that is important. How to deal with it is another issue. But I can't answer your question in terms of broad screening by blood testing. I'm sure there's someone in the room who can.
Well, I don't think we know, but the reason I mention it is the asthma problem where my office is in Harlem now among kids is horrible. When we moved to Washington, Chelsea missed several days in school, and we thought, and the doctors thought, she was asthmatic or pre-asthmatic. We were really worried about it. And then we tested her for allergies, and once we got her off things she was allergic to, turned out she didn't have asthma. She just couldn't breathe for other reasons. And I think about this a lot. There may be some sort of filtering thing. I don't think you could possibly afford to give everybody the kind of blood tests I got right away, but it's something worth remembering, because I think a lot of these kids that we think have asthma either ought to be treated earlier, diagnosed and treated earlier, or if they don't have it, we need to find out what they do have and fix it. So go ahead. Jamie, if you could do something in the next 6 months, what would you do?
Without sounding arrogant, I'm really proud of Napolz's program, and I would say we would continue doing what we're doing, and for us is to continue trying to do that better. From an in-house perspective, from an out-house perspective, for lack of a better term, probably continuing. We do a lot of support for other companies. I do a lot of consulting. Folks call me and go, hey, we've got this program, how can we do it better? And but my guys, 100% of my company gets screened. So there is a huge amount of awareness there. And I would say that it's infectious. Health is infectious. And our folks go out and they spread this into their churches and into their civic groups and into their communities. And they become champions based on what we have done and what we have given them. So that's why I say, not to sound ugly or arrogant, but it's really about continue doing what we're doing and just supporting others who don't have maybe what we have.
Let me ask you something. Do you think, I want to ask you 2 questions about it. Do you think what you're doing is, over a given, let's say, 3 to 5 year period, actually holding down your health care costs?
Yes, sir.
And
Yeah. We save about $500,000 a year and have for the past 4 years.
so should there be, or is there, as a part of this program, some system by which we can send your counterparts from other companies to some place where they can learn about all this?
They can call me. I mean,
No,
really,
but I think that's important. I think, a lot of people in smaller companies often think that, well, this sounds like a good idea, but if I do this, it's just one more thing I've got to do, one more expense I've got to bear, and it won't pay out for us like it did for Nabholz. They're a big, successful company with a heavy cash flow and lots of employees. And my instinct is the kind of stuff you're talking about would save everybody money and improve all the workers' health if they just knew it. And maybe one of the things that we ought to do is to do more to try to share these lessons in a systematic way with other employers.
I'm working with a company right now in Cabot with 34 employees. And I spoke last week at the Rockefeller Institute, which was phenomenal, by the way. And I said, one of my examples was, if a heart attack costs $75,000, you're going to spend the $75,000, right? So take 40 or 50,000 of that and put somebody on the ground. Take the other 25,000, screen your folks, and give them an incentive. I mean, you're going to spend the money anyway, so why not invest it back into your people and hopefully prevent those 75,000, 75,000, 75,000? That doesn't make sense. That's not good business. Invest in your people and then prevent those chronic diseases that are very, very costly, especially over a long term.
At Verizon, we're very proud. I mean, we were talking earlier. We have a health and wellness center that's state of the art. The company is really involved with health and wellness for their employees. Myself, 37 pounds less now, working out in our gymnasium there and utilizing the facilities. I think the key is, once again, getting everyone involved and making sure that the employees and the department leadership understand the value of it. Absenteeism is reduced. Healthcare costs for the company overall is reduced. And then you have a much healthier employee, which means a much more productive employee. And Verizon really sees the advantages of that. I mean, we have classes, 2 full-time on-campus individuals which are dedicated solely to the healthcare of the employees there. So we recognize it. And as James touched on, from a business of 34 to someone who has a campus which has over 1,000 employees, health and awareness from the education standpoint at the office is very important also.
Montine, a lot of your members are very small businesses. And you were just talking about teaching people to prepare food differently for your customers who may want something different to become aware. What about all the employees of all the restaurants and all the little cafes and throughout the state? Is there any way to systematically reach them?
The millenniums and looking at, a lot of our employees are a part of that generation. And that's one of the things that the National Restaurant Association is looking at is how do you communicate with them. And I think there are going to be some interesting things to come out about that, because it is a challenge at best.
Let's talk before we break up. I think it's worth talking about this blueprint that you were all a part of developing, because it seems to me that the best thing about it is it was formed from the grassroots up by taking input, and by definition it's shaped by what you're already good at and what you think you can get better at. So would you say a little about that? What do you think the most important things about this blueprint are, and how can we get people who aren't in this room today to sign on to it, to be a part of it? What kind of greater outreach can we do? How can we publicize it better? What's the best thing about it? Because the good news is we got a plan and everybody's already signed off on it. It's going to help implement it. But just think what would happen if miraculously tomorrow morning, everybody who could make a contribution to this in Central Arkansas actually knew what was in the blueprint and could pick out what it could do. How could we do better with that?
I'll go back to what I said before. I think that we need to have a broad understanding in society of the importance of health to everyone's future, and that we are in fact all in it together. And if in fact, I mean, this blueprint is fine. The secret is not the strategy; it's implementing it, and getting it implemented really requires a center of gravity and the coalition that's going to drive it forward. To me, that's the imperative. I think the most important aspect of this is it's explicit in recognizing that the contributions to health, good health, ill health, are broad and include environmental issues, policy issues, access to health care, behavioral issues. They're really cross-sector, and I think we've got work to do to understand how we need to move our interventions upstream away from providing care after events have happened toward the prevention of the events in the first place. And that really requires, I think, a broader understanding. So I hope we spend time educating everyone as we're getting started with this. And don't leave that behind, because this is a room of the converted. The others out there are not. So.
Yeah, I still think that we have a ways to go to develop a wellness culture in America. And I think it's very interesting how many people like you or Russ or other people who spent their lives taking care of people who are sick, and the rest of us have been one at one time or another, are prepared to spend so much of the rest of their lives trying to keep people from getting sick in the first place. I think it sounds so simple, but just that mindset, shifting that in every family in the state will cause a lot of these questions that haven't been asked to be asked, and people will find a lot of their own answers without our help if we do it. Go ahead.
Well, I just think it's dedication and collaboration. You know, the private and the nonprofit sector have to be dedicated in this effort. I think there's definitely, when you approach another project of this magnitude, there's a degree of skepticism on who's going to do it, how it's going to get off the ground, what's going to happen. So, of course, there has to be that dedication. And then, you know, the collaborative effort between, you know, leadership and everyone to getting together to really make it happen. I think that's the key. And then as the things continue to happen, the great things that are educating the community. So then everyone wants to be part of it. Everyone knows they can benefit from it, and everyone wants to be involved with it. So I think those are the key efforts there.
One of the things I noticed about the blueprint was, and one of your Verizon's commitments was to work with partners to create more community health workers, which I thought was really interesting because of what you said about people in rural areas, that they did have access to broadband, they could get this, they knew that. But in order to make it work, there has to be some human contact. And that's what we're learning more and more and more. The most successful, like even political strategies, you can get all the big sophisticated data in the world and it'll tell you to go down this block and knock on these 3 doors and leave those other 4 alone. They ain't ever going to be for you. But you still got to have somebody knock on the door. You know, and I think that I was really impressed that Verizon, a high-tech company which deals with distance communication and with making it easier for people to navigate through their lives without having to physically go somewhere, recognize that somebody's got to go somewhere. And I think this whole community health worker thing, this is what I started when I gave you the Zambia example, is really important. We sometimes forget that people in our own midst who, particularly if they're beat down, if they're poor, if they haven't been able to find a job in months, if they have trouble, nothing in cyber world can make up for human contact to bring people back into the mainstream of the rhythms of life. You just can't do it. And I want to thank you for that, because I thought that was one of the best things in the blueprint about your commitment? Montine?
Well, the education is important, but what you're saying is involving people is how you can better change behavior, and somehow we have to get more people involved.
Well, if you look at the percentage of people who come into some restaurant that's a member of your association or every week, it's a pretty high percentage of the people in the state, I think. Don't you?
Yes.
So
And I
that's-
think the more successfully a restaurateur handles them and their questions and taking care of their health issues, the more they're going to get involved in the future and believe in it.
I think probably needs to start with me. I need to look at myself and ask, am I doing all that I can, whether it's in my personal life, my health, my fitness? Am I being a good role model? And if not, then I need to do better. And then again, I'm going to go back to hopefully somebody recognizes that and says, hey, I want a little bit of what you have, because I like that. And so that's that infection. And so I'm going to say it's got to start right here.
You told a story a minute ago about going to a company that had 34 employees. How much of your time do you spend doing that, relating to people outside Nabholz?
The company, Nabholz, is very proactive, and they have said do this for free, just help folks out. And kind of the philosophy is, as long as it doesn't take away my time with my guys and my relationship with them, then they've given me leeway to go help others.
If there were 100 of you in Central Arkansas, it would make a big difference, wouldn't there?
We would rock this place. It would be awesome.
And that's one thing we might do to activate this blueprint quicker. I mean, I think, if you could find somebody like you in every company that's already doing something like what you're trying to do, that were willing to actually go out to all these other communities. I think you cannot underestimate the extent to which most people get up every day and do the best they can with what they think their options are. And it's all they can do to keep body and soul together and to meet the bottom lines and do what they have to do. And unless someone comes in that they can identify with and say, you do have other options. There are other things here that you can think about. There are things you can do that won't bankrupt your business and won't wreck your life and won't make you miserable because you never get anything you like to eat. I think it makes a huge difference. A big part of all of our lives, my Secretary of Education, Dick Riley, had been, when I was president, had been governor of South Carolina, and he was the very first courageous man. He had a terrible health problem that he overcame over a period of 14 years with almost no medication, where his spine was fusing together and he had to keep straightening up. It was an amazing thing. But he always said that my biggest problem is that everybody is always secretly saying, let's change, you go first. So those of you who have gone first, I think you can't possibly underestimate the power you have just to change the way people think. Their universe, we all get up every day and our reality is contained in little boxes. And I find, the older I get, the more I want to be left alone to stay in my box some days. And the whole secret of a growing life is to break out of those boxes. And so anyway, it's very encouraging. One thing I will tell you is that I follow brain research closely, and one of the things we learned in the last couple of years is that people, even though your brain begins to shrink when you're somewhere in your late 20s, early 30s, you still got a lot left that you haven't used. And it was now been pretty clearly established that you can continue to form new neural networks, in other words, absorb new possibilities, way into your late 60s and early 70s. So it isn't too late for all of this stuff to really take hold, for us to literally change the mindset of our people, and I think it's really important. I think, Doctor, I'd like to give you the last word. I know we're out of time, but why do you, what's happened to make so many people who are in healthcare more interested now in keeping people from coming to see them? I say that in a good way. It's sort of in promoting a wellness ethic.
I think that the ethics of the health of those who are in the health professions are very high. And I think that they are motivated by improving the health of others. And there's an increasing recognition that our health system is well designed to deal with the consequences of illness, but not well designed to prevent the illness in the first place. And we're interested in seeing positive change for the benefit of our fellow man. I mean, I don't think it's that complicated. And so we're seeing a lot of engagement in changing the business model, even though it is really difficult, right? Because we got to get payroll out, we got to deal with the system we have today. I just think it's the motivation of of those who are health professionals and those in administrative roles in the health professions. We've also, if I could just say one other thing, we're focusing a lot on the whole notion that this is truly an interprofessional effort. It's a trans-sector effort, it's an interprofessional effort, and we're focusing a lot at UAMS on inculcating these concepts of a more holistic approach to improving the health of a community and of individuals and families, rather than just the narrowly defined skills and knowledge associated with treating specific diseases. So that's a longer term change, it's a bigger scale change, but I think we're going to see that within the health professions in general as well.
Let me ask you one more question. Do you think that, suppose we see great success in this effort, will it change dramatically, and with the inclusion of more people who haven't had insurance before in the ranks of insured, is this going to change dramatically the mix of physicians we need and the mix of healthcare providers generally? Will it lead to are we going to have a huge, at present trends, unmet demands for general practitioners and for nurses and community health workers, and relatively speaking, a more stable demand for specialists?
The population is aging, so I don't believe that the demand for the specialty services is going to go down, but we certainly are going to see a change in mix. And I don't think we should focus on the physician workforce in isolation. We really have to think broadly about teams and how we develop team skills, how we house the information and electronic information resources that's available at the time and point of care, and how everyone from community health workers to health educators through specialists work together to achieve outcomes. And as the payment moves in that way, the skill mix will change, and I believe we'll see a lot of experimentation. In Arkansas, that's what we're going to see. The Payment Improvement Initiative, we're going to see a lot of experimentation and innovation occurring at the level of individual practices, communities, and health systems. And that's a good thing. It's taken us, we've been on a path since the passage of Medicare in 1965, and now we're starting down a different path, which is good.
Yeah, I was hoping you would mention it, but I just wanted, the only way to really change it is to, without hurting the healthcare delivery system we have, is to change the way the payment systems work nationwide so that they will follow the shifting needs and not disincentivize them. And I think Arkansas has done a remarkable example of that. So most people in this room probably know that, but we have some members of the press here and others. So maybe you could just give us 2 minutes on what the new payment system does and why it will allow the evolution of a better health system in Arkansas.
Well, so there's the Affordable Care Act and the decision that was made for the private option expansion within Medicaid. That's one piece which provides access. The other piece is what we call the Arkansas Payment Improvement Initiative, and Joe Thompson is here, has really kind of led much of that under the leadership of the governor, and that has 2 foundational elements. One is the creating of a business model for patient-centered medical homes, which involve payment streams for achieving outcomes for the entire population cared for by a primary care practice. And then the other piece is episode-based payments that's focused on transitioning from paying for every transaction to setting a set amount of dollars that is the target for a defined episode of care. And in both of those circumstances, there's a premium for improving health. Right now, we try to achieve health because we have high ethics and we're driven but for the right reasons. But the payment stream is linked to the volume of services that we document that we provided, not to the outcome that's achieved. So this is a major shift. It's not going to happen quickly. You said, are we going to see, a quick change? It has to happen slowly enough to enable us to do everything we do every day, whether it's in Baptist or UAMS or another health system, in the existing model while transitioning to a new model. So that's changing the tires while the car is running. And so that's a complex process. So there's got to be a certain patience with the pace of change. But I do think it'll happen.
Well, it's a good way to end because I think that this change you've made is 10 years from now, you will look back on this and see this as one of the greatest things that ever happened. You can be really proud of your state for doing this. And every place that they're trying to do this, they're getting dramatic results. With increasing coverage, but also having a wellness-based thing, having medical homes. I saw a story the other day that in Minnesota, where they've done a lot of this work, in the individual insurance markets there, their premiums are running 2/3 lower than Wisconsin next door. Partly because they're trying to move to a wellness model without in any way sacrificing the ability to give the highest quality of care to people who have needed it. And so you should be really proud of your state for doing these things. And I thought because I don't want us to overlook the fact that they're at the center of all these efforts we're making. People will still get sick, people will still have accidents, things will still happen, and they will have to still be cared for. But shifting the way we think about it and then the way we all act is important. And the fact that we have a political and a medical establishment in this state prepared to start moving in that direction, I think should be a source of great optimism and pride to all of you. So thank you. And I can't say enough to thank our other panelists because they set a real example for how the private sector should behave in these circumstances. And if you haven't read the blueprint, you should. Thank you very much.
Thank you.
Thank you, President Clinton and our panelists. We're so gratified for your time today and wonderful remarks. Just 3 themes I'd like to pull out. One is the power and purpose of purposeful partnerships that we heard about here today. The other is that there's clearly a place for everyone at the table to help us really achieve the actions that are laid out in the blueprint. So we hope that you'll join us in our efforts as we move forward over the years. And the third is that health is infectious, as Jamie mentioned, and that all of us in this room can also enlist others across Central Arkansas to get involved and engaged. And we really need that collective action in order to make Central Arkansas the healthiest part of the United States. So want to offer you the invitation to join us and get engaged and involved in the effort here. I also want to recognize Tiana Jenkins, who is our regional director, who will be serving as the convener of this effort in Central Arkansas, and wish you a wonderful holiday season and a happy new year. Thank you so much.